Hey everybody, Dr. Joe with Upper Cervical. I wanted to talk to you guys a minute about fibromyalgia. We have a lot of people in our office that suffer from fibromyalgia. A lot of people, even more people outside of our office that suffer from it that ought to be here to get some relief. And fibromyalgia, the reason I want to bring this up is because it's a very, very painful condition that's associated with a lot of physical pain. And if left there for long enough, it actually causes a lot of mental, emotional pain as well, because a lot of these people have been living with this condition for years and years and years. And let me draw an example for those of you that don't know what fibromyalgia is, or maybe don't know if this is what you have, an example of what it looks like. This is Bob right here. Bear with me, I'm not an artist, I'm an upper cervical chiropractor. But what Bob looks like right there, what happens in fibromyalgia is in a normal body, there's a lot of hot spots, what we call. And there's, I believe, 18 of them in the body, and you need 11 of them to be aggravated in order to be classified as fibromyalgia. What happens, a lot of times these hot spots occur in the shoulders, neck, the low back, buttocks and hip, wrist, hand, elbows. If 11 of these spots are inflamed, are aggravated, are symptomatic, that is classified as fibromyalgia, which when we break that word down really means muscle fiber pain. So it's a very, almost like an umbrella term to classify what really is a really chronic pain issue for a lot of people. And the sad part is a lot of these people that suffer from this condition, they have to take medications that are like gabapentin, that are really nerve pain medications, which are not fixing the problem, because they found that in science, actually 60 to 70% of fibromyalgia actually begins with a neck injury. And I'm going to use an upper cervical model, which is going to come out of thin air. Look at that. What happens is when there is an upper neck issue, right here, this black electrical tape that you see right there, when this neck gets twisted from any sort of trauma, car accident, slip, fall, injury, it gets pressure there. After years and years and years of developing, this can actually cause people to have fibromyalgia. It's a trickle-down effect when there's structural shifts in the body and the neurology is affected. The end result is really painful, debilitating conditions. And the thing is, that gabapentin that I was just talking about is not covering up. It's just covering up a problem. The cause is why it's there to begin with. That's why we help people with fibromyalgia all the time without the drugs, without the surgery, when we address that root cause. I hope this helps. If you know somebody with fibromyalgia, please share this with them, because it could possibly change their life. If you like this content as well, make sure to follow us on YouTube and our Facebook page, because we're going to be continuing to drop more great things just like this in the future.